Zampatti from the Corio Sports Treatment Clinic. Today I'm going to show you a taping technique that we use for people that have got elbow pain or tennis elbow, where the extensor muscles of the forearm here get sore from doing gripping, grasping sort of activities. So we're going to use rock tape as a way of providing some support. It's very good for pain relief when things are acute, as well as giving some support during activities involving grasping. So we basically use the tape here. Tom, just hold your arm out for me. We're going to tape pretty much from here down the forearm to about there. So if we work out roughly how much we need, we cut the tape off the roll. We cut the corners to make sure that when we apply the tape that the corners don't lift. When you round them off, they basically prevent the corners of the tape from lifting, and you get a better adherence of the tape. We're going to use that one for a start. So what I do is I get Tom to relax your hand and have your hand in a slightly downward pointing position, so the fingers are straight but the wrist is flexed. And we start just above the crease of the elbow and over this portion of the forearm. So we start a little bit above. We have no stretch on the tape at the top, and then we apply 25 to 50% stretch over the middle portion of the forearm, and then at the end there we have no stretch. All right, give it a good rub to hold and adhere well. Then we basically take another piece of tape that's about 10 to 12 centimeters long, and we're going to do a cross taping. So it depends on the size of the forearm whether you have more or less. Essentially you do the same with the taping, rounding off the corners, and then we use our band-aid technique where you tear down the center of the tape, fold the paper back, and then we want about 50% stretch. So we go over the area where it's most sore, which is generally here just before the elbow. We put some tension on and we lay the tape down over that area of maximal tenderness. It's under stretch across the sore spot and across the other tape, and then the bits on the outside have no stretch. All right, and then you can relax your hand. Just grasp and squeeze there, Tom. Generally, if you've done a grasping clenching exercise beforehand and it's painful, you retest it once the taping technique's been done, and quite often there is a significant reduction in the soreness in that region. Even if there's no reduction in pain there, the tape helps to provide some support that helps in reducing pain over time, even if it's not an immediate reduction in pain. But quite often we see an immediate reduction in pain. Not abolition or totally gone, but reduction. So good technique for helping pain, providing support, helping you to keep active and keep doing the things you want to do.